Can you see the slides?
Yes, clear.
All right. So the neurobiology of yoga. So before that, Hemanji, your this thing was excellent. Your presentation was excellent. Thank you for that. So the neurobiology of yoga. So since we deal with mostly, the mental health and neuroscience aspects at NIMHANS. So we mainly focus on neurobiology of yoga. And previous session, Dr. Hemant has already spoken about how yoga might be beneficial or the physiological effects of yoga in other disorders. So we will go on to so yoga, as I think by now you are well versed in this than me actually. So it's a mind body spirit technique. So we also consider yoga as a biopsychosocial phenomena, which addresses the biological, social, and psychological aspects when we advocate or practice yoga. So it's a unique practice which involves all three components, which are all three components, that is the mind, body, and spirit. So I'll skip all these things because you already know all these things. So coming to what are the beneficial effects of yoga? So forget about mental health and neurosciences or any of these disorders. If you see, yoga is not just practiced in India, it is practiced, across the world. Probably sometimes you can see that more Westerners are practicing yoga than what we do. Our population is more, so we see that many people practice. But if you look at, number of people per population that, who practices yoga, probably Westerners will overtake us. So the primary reason it has become so popular is people say it reduces stress, improves overall health, emotional well-being, improves sleep, and a sense of control over their health. So these are the common, common reasons why people join or practice yoga. That is, it reduces stress, improves the overall health, and these things. But at the same time, we have also observed at our institute as well as elsewhere that there are a lot of beneficial effects in treatment of depression, anxiety, post-traumatic stress disorders, psychosis, cognitive decline like dementia, etc. This is psychiatric disorders because my work has been primarily in psychiatric disorders. Of course, in neurological disorders, it is much more beneficial, which is already covered, I guess. Then coming to how popular the yoga has become in scientific literature. If you go to PubMed and just type yoga, you will see more than 9,000 publications, which is there till date. In fact, 25, there are very few publications. Already there's more than 100, although we are in the third month of the year. So it's like 9,000 publications, and out of these, 90% of the publications are from last 2 decades. So you can see the rise in popularity of yoga. And this is not without any reason. This is because of the beneficial effects that yoga brings about in vast variety of physical and psychological ailments. So now coming to what is the neurobiology of yoga. So neurobiology of yoga, if you ask me, what I am going to say next is mostly probably due to this, probably due to that, except for a few evidences where it has been proven that yoga brings about these changes. Otherwise it's mostly the evidences are experimental and leading in a particular direction. That is what we will be examining discussing in the next slides. So when we talk about the neurobiology of yoga, the most common biological mechanism that has been quoted as modulated by yoga is the modulation of the hypothalamo-pituitary adrenal axis and sympathetic nervous system response. Okay, so yoga for stress, yoga for anxiety, yoga for depression, yoga for PTSD, all these primarily act through by modulating the hypothalamic pituitary adrenal axis, okay, and by modulating the sympathetic nervous system or the autonomic nervous system. Okay, so basically, to be put in simple words, yoga, it modulates HPA axis and decreases the sympathetic activity and increases the parasympathetic activity. So now, since we talk so much about stress, let's have a brief overview on what is stress. So now, coming to what is stress, stress involves multiple systems. When a person undergoes chronic stress, I'm not talking about acute stress, I'm talking about chronic stress. There are several systems in the body which gets in. First and foremost, of course, it is nervous system. Followed by that, it will be the endocrine system and then the immune system. So nervous system results in alteration in the neurotransmitter levels. The balance between the glutamate and GABA neurotransmitters is disturbed. When then the endocrine system, there the hormonal level alterations happen. For example, the cortisol levels in chronic stress is always higher. For example, in any of the psychiatric disorders, if you see, particularly depression, then immune system. So because of chronic stress, the immune system also gets affected in such a way that some of the pro-inflammatory cytokines like interleukin 6, then interleukin 1 beta, C-reactive protein, all these generally become or higher in these subjects who undergo chronic stress compared to that of those who do not have a chronic stress. So all these mechanisms, these are some of the mechanisms. I'm not saying these are the mechanisms. Because of derangement in these systems, it finally leads to a disease manifestation. That disease manifestation could be physical or psychological or both. Okay. Next, coming to the neurobiology of stress, I think you all know about this. Stress, anybody experiences stress. For example, acute stress. If you are driving and suddenly somebody comes in front of your car or your vehicle, you suddenly experience a acute stress. Acute stress, yes, it is manageable and it dies down once the stimulus is gone. Okay, and this is mitigated by a active neurobiological stress management mechanism where HPA axis plays a role. But what happens when there is a chronic stress? So when there is a chronic stress, there increases an allostatic overload. Okay, that is the physiological burden of stress on the body. Okay. So due to continued stress, there is a physiological burden on the body, which is called as allostatic load, which disrupts or disturbs the stress management system. Okay. So whenever acute stress happens, whatever corrective measures used to happen in your body, that gets disrupted. So that leads to mental and physical health. And believe me, this doesn't happen only in a person who experiences it. Say, for example, if a chronic stress is seen in a pregnant woman, that can also affect the unborn child, and that child, there are chances of developing some psychiatric disorders in future. So this chronic stress, chronic repeated stress is one of the most root cause of majority of the neuropsychiatric illnesses. So this is an extended this thing of neurobiological effects of yoga. So basically what we mean to say here in this slide is yoga. Now we understood the neurobiology of stress, and now this picture represents how yoga reduces the stress and related affects the stress and the related mechanism. One is by the top-down approach, and the other is the bottom-up approach. Basically, yoga decreases the psychological stress as a top-down mechanism by its concept of acceptance and resolution of conflict and coping with emotional pain. And at the same time, it also reduces the interoceptive stress, that is the um sense of perception of the internal self, that is interoception. So the interoceptive stress is also um, reduced by yoga. This happens by multiple mechanisms. One is by cognitive coping, so which is mainly primarily carried forward by DLPFC. Then the reduced negative emotions by ventromedial prefrontal cortex as well as amygdala. Then it also normalizes the HPA axis, which we spoke earlier, and it also restores autonomic balance, which we will discuss in the next couple of slides. So thereby, yoga comprehensively reduces the stress and the ill effects due to stress. Now, coming to, I was talking about yoga reducing the sympathetic response and increasing the parasympathetic response, thereby modulating the autonomic nervous system. So the measure, how do we measure these things? So I spoke about top-down approach, bottoms-up approach, and I said these regions are controlled by these regions control these cognitive functions, and this is targeted by yoga, and it modulates these functions. How do we study these things? So these are studied by various investigational techniques. One is the autonomic functions we will examine through heart rate variability, and any of the brain functions we measure through cognitive tests or using MRI techniques and EEG techniques and TMS techniques, which I will give a brief overview in the next sections. Next, coming to the first one, that is the autonomic function test. So in autonomic function tests, we look at something called as heart rate variability. So this heart rate variability is the change in the beat to beat variation in time or frequency. So this is one of the easily measured autonomic function test, because 5 minutes of ECG is sufficient at a very good frequency, is sufficient for measuring this, and it tells us about the physiological and psychological stress which can affect the autonomic balance. So generally in neuropsychiatric disorders, what happens is this heart rate variability is reduced. So so when yoga is when a person practices yoga for a continued duration, so the heart rate variability is restored to near normal. That is, the heart rate variability improves. That is, the sympathetic activity reduces and the parasympathetic activity increases. So there are some studies which have shown that the cardiac autonomic regulation with increased HRV and vagal dominances were observed during yoga practices, especially when regular yoga practitioners were compared with that of non-yoga practitioners. The vagal tone was increased in yoga practitioners. That is, the vagal tone, in the sense, vagus is a nerve which controls the autonomic nervous system. So that vagal tone was increased in yoga practitioners. In our own study, in our own center, we did a couple of studies. Sorry, I couldn't put those details here. So where we observed that yoga practices. One study looking at psychosis patients, that is treatment-resistant schizophrenia mostly. So there was a significant improvement in heart rate variability. And there was another study where we looked at Vamana Dhauti as a standalone treatment. Sorry, not standalone treatment, as an add-on to existing antidepressant medications, where we saw that there was a significant improvement in heart rate variability along with improvement in depressive symptoms. And we could also observe a correlation between the improvement in depressive symptoms with improvement in heart rate. Now, coming to the next evidence for neurobiological mechanism of yoga is the cortisol. So we were talking about cortisol and cortisol in the HPA axis, right? This is one of the study which was done way back, or at least a decade back at NIMHANS, where the antidepressant effects of yoga was seen in major depressive disorder patients. As you can see here, the patients who were given yoga, there was a significant improvement in HDRS scores. And at the same time, the cortisol levels also decrease in these patients. And uh, as this figure explains here, patients with increase in cortisol and patients with decrease in cortisol. Okay, and what we could observe was there was a significant correlation between the change in cortisol versus change in the HDRS. So that is, as the cortisol change increased, that is, as the reduction in cortisol was more, the reduction in Hamilton Depression Rating Score was also. So this says that as the stress reduces, the cortisol reduces, so the depression scores also reduces. Coming to the next most important neurobiological mechanism of yoga, that is the neuroplasticity. So neuroplasticity is defined as a neurophysiological process through which the brain adapts to changing environment by altering its molecular and structural features. Okay, so neuroplasticity plays a significant role in has played a significant role in shaping our brain and continues to play the role in health as well as in disease. Simplest example is how a person affected with hemiparesis, that is stroke, how he regains some part of his motor activity by continuous physiotherapy or exercise is basically due to neuroplasticity. So our ability to learn new things is also due to neuroplasticity. So neuroplasticity plays a major role in or has played a major role in human evolution, and it plays, and yoga is thought to affect this or improve this neuroplasticity. So how do we study neuroplasticity changes in brain and in neuropsychiatric disorders? We will look at that in the subsequent sections. One way of looking at neuroplasticity changes is by looking at the neuroimaging. So as we all know, brain is a very complex organ, and each part of the brain is unique, right? And it is covered by a thick skull because it has to be protected. Otherwise, it will be prone to damages. Now, when it is covered by a thick skull, how do we peep into the brain? How do we look at the activities of the brain? So that is done using neuroimaging techniques, right? So there are multimodal neuroimaging techniques which we use to study the functions and as well as structure of the brain. Those are electroencephalography. I think most of you know what EEG is. It's basically neural signals are nothing but electric currents which can be recorded using a technique called electroencephalography. Okay, this is age-old technique, relevant till date. Majority of the epilepsy cases are diagnosed using EEG, and not only that, many of the cognitive parameters are tested using EEG. Then comes the latest advancement, that is the magnetic encephalography, a very costly technique where the same electric currents, that is where the nerve transmits impulses and generates electric currents, that electric currents are measured using EEG, And the moving electric current also generates magnetic field, which is measured using magnetoencephalography. Okay, which this is a very costly technique. So if you check for MEG studies, the studies will be very few. Then comes the computed tomography or the CT scan, which we all know. So, but this is very rarely used for research purposes because of the radiation exposure. So then comes the hot favorite ones, that is the um, MRI, magnetic resonance imaging. So this is, uh, as the name itself says, it is based on a magnet. So using a high-powered magnet, the brain is imaged and it gives a very clear picture of the brain. Um, uh, then comes the functional near-infrared spectroscopy. This is a kind of poor man's version of MRI or fMRI. Sorry, this is a poor man's version of functional mapping of the brain. So where whenever the blood flow of the cortex, the cortical region of the brain is mapped using this technique, this is portable and 1/10 the cost or 1/20th the cost of MRI. And then comes the positron emission tomography or the PET scan. Again, this is also not very frequently used, again, mainly because of the need for injecting a radioactive tracer, which is which is again invasive, so and involves radioactivity, so it is not so much utilized. So the most commonly utilized are MRI and functional near infrared spectroscopy. Let's delve a little bit deeper into the MRI aspects. This is just to understand what we see as evidences. So in MRI, there are multiple types. Structural MRI, which is nothing but looking at the structure with respect to the volume of a brain region or with respect to the connectivity of the physical connectivity of the brain region. Okay, so this delineates the anatomy of the brain in greater detail. So you can measure the volume of a particular region. Like for example, hippocampus, if I have to measure the gray matter volume, I can measure it. Then I can measure the cortical thickness of certain brain regions. I can even look at the shape of the thalamus. So many things can be done using this structural MRI. And there is another technique within the structural MRI called diffusion tensor imaging, where I can look at the structural connectivity in great detail. That is, whether the connectivity between the connectivity fibers of the corpus callosum, which connects the two hemispheres of the brain, whether it is intact or not. So that can be observed using this structural. Then comes the cognitive scientist's hot favorite, which is the functional MRI. So functional MRI, as the name itself says, it is basically a functional mapping of the brain using the MRI technique. So it maps the brain activity by recording changes in the brain's hemodynamic responses. So basically what happens if you are given uh, given a pen and if you are asked to manipulate the pen in your right hand, we can see there is an increased activity in the left motor cortex. Okay, so this increased activity is mapped because you are functioning in the right hand has increased. So the activity in the left motor cortex, that is the contralateral motor cortex, has increased because there is increased activity there. So there is increased blood supply. So this increased activity resulting in increased blood supply is what is mapped in functional. Okay, so similarly, imagine if you are given a task to perform. Task in the sense, if I ask you to do, say, subtract, 7 out of 100 multiple times. So it involves a lot of areas like dorsolateral prefrontal cortex and those things. So during this, if you do the mapping of the brain, these regions will be lit up. Okay, so now how has this been used in exploring the neuroplasticity effects or the neurobiological effects of yoga is, so the studies which have examined the neuroplasticity effects of yoga on brain structure have shown that the majority of these studies have basically looked at have compared yoga practitioners versus non-practitioners, and what the study results show is cortical thickness was greater in the yoga practitioners. Of course, in this study they looked at the prefrontal cortex, but otherwise, in general, you can say that many brain regions in the regular yoga practitioners was thicker and had more volume compared to that of non-practitioners. Although the non-yoga, one can always debate that, that's because yoga involves exercise. So exercise also has a neuroplasticity effect. So that can lead to increase in volume or cortical thickness. But in one of the studies, they had also compared it with regular physical exercise doers, and it was found that the increase in cortical thickness and brain volume, or the regional volume, was observed only in regular yoga practitioners and not in the exercise. And this increase in cortical thickness was mainly seen in the prefrontal cortex, hippocampus, superior temporal gyrus, insula, precentral gyrus, parahippocampal gyrus, and many other regions. Okay, so this is one thing. And coming to not only this, the if you do yoga for 3 months and then leave, it's not like yoga is going to continue its magic further. So there people have actually established, dose response effects of yoga on brain structure. So there was in this study, what they observed was the duration of practice of yoga was associated with the increase in the volume of several brain regions. So as the years of practice increases, the gray matter volume in the gray matter volume also was more in those who had more number of years of practice than those who didn't have, who had lesser number of years of practice. So this establishes the dose response effects of yoga. So speaking about this MRI findings, a few years back, we had also looked at the effects of yoga on the brain volume. So here we had looked at healthy aging population, and so what we saw was yoga increased the volume of hippocampus in elderly subjects who practiced yoga for more than 3 months. So this was done in healthy aging, and hippocampus is why we targeted mainly hippocampus is as the age advances, the risk of dementia is high, and the risk of memory deficits are high. So hippocampus is the seat of memory deficits and many other uh, cognitive aspects. So we looked at the hippocampus, and within 3 months of practice, there was a significant betterment in the hippocampus volume compared to that of non-practitioners. Next, coming to the effects of yoga on brain function. So I was talking about the what is that? The fMRI, that is the functional MRI. So in one of these studies by Gote Pian et al., it was found that the dorsolateral prefrontal cortex showed lesser activation in yoga practitioners compared to non-practitioners. Okay, in one of the tasks called working memory task. So the focus of this study was to evaluate the effect of yoga on emotional reactivity, considering the emotional valence of the images. So basically, what this study showed was the impact of the images were not too much on the dorsolateral prefrontal cortex, and it was what do you say? The impact of the yoga was such that there was not too much salience which was attributed to the valence of the images which were given to the subjects, whereas it was not so in case of non-yoga subjects. Now, coming to another aspect of yoga, which is the dhyana or the meditation. So if you look at yoga and MRI or fMRI, you will find very few studies, to be honest. That's primarily because Westerners somehow have detached or separated meditation from yoga and made it as a separate concept, which is actually unacceptable because as you all know by now, dhyana is part and parcel of the one. It is one of the eight limbs of yoga. So essentially, meditation is part of yoga. And if you see, many of these meditation studies have shown that there were network of areas which spanned from occipital to the frontal lobe, which were highly activated during the meditation condition than in the control condition. Okay? So similarly, this was a study which we did at our place at NIMHANS, where you know Om chanting was done, and what happens to the brain activity during Om chanting. So what we observed here was there was a significant limbic deactivation following Om chanting. Okay? So this deactivation was seen in amygdala, anterior cingulate, hippocampus, insula, orbital frontal cortex, parahippocampal gyrus, and thalamus. So if you ask me, what does it exactly mean? One thing I could speculate, or I could say probably is it regulates the emotional valence. One thing. Second thing, what I would like to focus is yoga does something to the brain, correct? So it is altering the structure, it is altering the function. So yoga is doing something to it. Now, how this can be, used as a treatment as for aspect of neuropsychiatric disorders, it depends on the pathophysiology of those neuropsychiatric disorders. Similarly, another study observed a greater functional connectivity between the anterior prefrontal node of salience network and multiple default mode network nodes during meditative state. So basically telling that yoga significantly affects the structure and function of the brain. Okay, so similarly, there was another study which also looked at the effects of uninostril yoga breathing. I think Hemant knows this much better. It is his own paper. Effects of uninostril yoga breathing on brain hemodynamics. So, how yoga affected brain function differently. That is, the right nostril breathing had a different effect than compared to that of left nostril yoga breathing. That is correct. Means I don't know much. Hemant, please correct me. The Chandranuloma and uh, Suryanuloma. So it has different names for right nostril and left nostril breathing. So it affects differently. There is a differential effect on the brain when you breathe through right nostril and when you breathe through left nostril. Okay, then coming to the next this thing. So effect of yoga on neurotransmitters. So neurotransmitters, I mentioned about GABA and glutamate. So our brain is mostly the balance between the balance, critical balance between the neurotransmitters. There are many neurotransmitters. Of them, the most important ones are GABA and glutamate. I'm not, you know, not saying these are the only two important ones, but these are the most important ones. So there is a technique called as magnetic resonance spectroscopy, which can measure the levels of neurotransmitters, either GABA or glutamate, depending on what sequence you are putting. So it can measure the levels of GABA and glutamate. And using this technique, there are several studies which have looked at the effect of yoga on neurotransmitters. What was seen was MRS study showed an increase in GABA levels in thalamus after yoga practice, while no changes were observed in control subjects who just did walking. Okay, and GABA is the mood levels generally correlate with that of GABA. Okay, so GABA plays a significant role in depression as well. So doing yoga has a significant effect on depressive symptoms. probably through modulation of HPA axis as well as improvement in GABA levels. So this is skip this. Okay. So we'll come to another neuroplasticity marker, a very well-known neuroplasticity marker called brain-derived neurotrophic factor. So this brain-derived neurotrophic factor is something which is very commonly examined in any research study or any biomarker when you consider in case of depression. So, and in general, most studies have shown that patients with depression have reduced brain-derived neurotrophic factor. And so in one of the studies, we also found that the BDNF levels were reduced in depression patients. And after giving yoga, there was a significant improvement in BDNF levels. As you can see here, this is the yoga only group. That is, there were three groups, that is yoga only, yoga with medication, and only medication. Okay, as you can see here, both yoga only group and yoga plus meditation, medication group showed a significant improvement in BDNF levels. However, the yoga only group showed a significantly higher elevation in BDNF levels compared to that of yoga plus medications. The probable reason could be because medications might have its own mechanism of improving BDNF levels or affecting the BDNF levels. Probably that's why we find yoga only group to be significantly better in improving BDNF levels. This. However, the take-home point is yoga alone can enhance BDNF levels, and hence it has been considered as one of the first-line treatment in case of mild to moderate depression. Next, coming to effects of yoga on cortical silent period. Again, I was talking about GABA, that is an inhibitory neurotransmitter in the brain. This cortical silent period is a parameter which is utilized in a technique called as transcranial magnetic stimulation. So this cortical silent period basically represents GABA activity, okay, in the brain. So what here we can see is cortical silent period activity was reduced in non-yoga practitioners. That means the GABA function, that is the calming function. GABA is an inhibitory neurotransmitter, so it basically calms the brain. Okay, so that was less in non-yoga practitioner compared to that of yoga practitioners. Okay, so further the evaluation of these cortical effects of yoga and cortical silent period. So as you can see here, there was a significant improvement or enhancement in the cortical silent period following yoga. This is pre-yoga and this is post-yoga. So this is again so before yoga how it was and after yoga how it is. So basically there was a significant improvement in the GABA function, which says that there was a significant calming of the brain. So this is something similar, the cortical silent period. So how the CSP or the GABA function is seen in depression, pre-walking, post-walking, pre-yoga, post-yoga, and how it is in healthy subjects. So as you can see, this post-yoga, it is coming closer to that of healthy controls. Probably with regular yoga practice, it can definitely reach up to the healthy controls. So having spoken about neuroplasticity, then spoken about endocrine changes, autonomic function changes. Now we will come to the immune changes in the immune effects of yoga. So there are neuroimmune effects of yoga as well. Yoga is shown to downregulate pro-inflammatory cytokines or the pro-inflammatory markers like IL-1 beta, interleukin-6, TNF-alpha, etc. And yoga seems to have a dose-response relationship as well in dose-response effect on these markers. So this is a study which was done in patients of HIV positive patients. So in HIV positive patients, what happens is there is something called as CD4 cells, which is a protective cell. So these CD4 counts reduces, and the viral load, that is the number of viruses in the blood, increases. So the aim of the treatment in HIV patients is to increase the CD4 counts and reduce the viral. Okay, otherwise what happens is they will be susceptible to, they will have immunodeficiency, and they will be susceptible to many disorders due to the immunodeficiency. So what you can see here is, here the CD4 counts were low, and after yoga there was a significant enhancement in the CD4 cell count. So this shows that yoga improves the CD4 count, and at the same time yoga also reduced the uh, viral load, probably because of enhanced CD4. So this shows that yoga has a significant effect on the immune system. So in addition to this, yoga also has a significant effect on oxidative stress. Oxidative stress is considered one of the primary factor which actually induces aging in any living organism. So as as we live, what happens? There is continuous ATP production because of oxidative phosphorylation and those things, which also generates something called as um, free radical, oxygen free radicals, which can damage our body, which is a natural process. But again, yoga is found to reduce this oxidative stress. This has been examined using one test called telomere length. So this telomere length, actually, the more your telomere length reduces, more is the aging, more is the reduction in lifespan. So yoga, regular practice of yoga has shown to protect this telomere length, basically saying that it reduces the oxidative stress. So coming to the last couple of slides. So this is to summarize the neurobiological effects of yoga. So basically, yoga affects the neurotransmitters. It affects the inflammation, neurotrophic factors or the neuroplasticity, and HPA axis. On HPA axis, it reduces cortisol and modulates autonomic nervous system, whereas it acts on the neurotrophic factors by increasing the BDNF, that is neuroplasticity enhancing molecule, and it increases the telomere length by reducing the oxidative stress. Then it increases GABA. I did not talk about other you know neurotransmitters. I just focused on GABA. So it basically, it can enhance GABA so enhancing GABA has a calming effect, increasing oxytocin. So oxytocin is a social hormone, so it can help in emotional bonding or developing emotional quotient. It increases, or basically it balances dopamine, increases beta endorphins, etc. So by modulating these, it can modulate the psychopathology of psychiatric disorders. And inflammation and oxidative stress, as I told you, it can reduce the pro-inflammatory cytokines and enhance the anti-inflammatory cytokines, and hence provide neuroprotection, ultimately protecting the brain. Okay, so this is the summary of the neurobiology of yoga. Of course, having said this, many of the studies which have given these evidences to us has a lot of shortcomings. Like any other study, it has a lot of shortcomings, not just because it's a yoga study. One and primary and most important is yoga practices are heterogeneous. So everybody coins their own yoga nowadays. So which is the authentic yoga, which is not authentic yoga? So that's a very big debate as of now. So we can't say which yogic practices have brought about changes in these studies. And of course, you all know blinding is a major concern in any yoga study. You cannot blind the patient, from not knowing whether they are taking yoga or physical activity. And third thing, which is slowly moving away, the cultural acceptance is reducing. in the sense, rather, I would say cultural acceptance is increasing. Nowadays, everybody is accepting yoga. So, but still, some resistance is still there. So, in fact, within our country, the resistance is more compared to elsewhere. So that should go. And standalone yoga studies in several disorders is not allowed. So, a clean sample wherein to look at the beneficial effects of yoga alone is difficult. Maybe, we can get there very soon. And long-term compliance is a major issue for any research study. So long-term compliance, if that is there, then we can definitively say whatever effects we are seeing now, maybe double or triple effects can be seen if the compliance and long-term compliance is made. Thank you.
Thank you. Thank you very much, Dr. Shiva Kumar, for providing us very valuable insights into the probable, and some definitive mechanisms of actions of yoga. Now, students, if anybody has any question, any doubt, one wants to comment, please unmute and share. Or you can type in the chat box.
Sir, you mentioned of stress in immune system cytokines. What are the cytokines and how they are affecting that?
Sorry, come again.
I'm asking, sir, like when you are describing the stress response, mainly chronicle. So there you describe endocrine, immune, and nervous. So I'm asking, in immune system, you describe cytokines. So what are these and what is their role and how they are affecting?
Okay, cytokines are considered not only immune markers, they are also considered as a neurotrophic factor. So cytokines play a significant role not only okay, I will answer your question first. The cytokines are the molecules which actually battle. These are the which fight the battles in your body, in the sense if there is an invasion by bacteria or virus, so the immune system reacts and it sends cytokines to fight against these pathogens. Okay, so these cytokines, during COVID you must have heard about cytokine storm. Have you heard about cytokine storm, which was very popular during COVID? So basically, whenever a pathogen enters our body, these cytokines are released to fight against these pathogens. But if these cytokines should come as acute response, and it should be at a particular level. But if these cytokines become overwhelming, that is, if they become too much, it can damage our own body. This was called as cytokine storm. Okay, so these cytokines, due to chronic stress, what happens is the body, the cytokine levels will always be high compared to that of the healthy controls. Okay, so these cytokines, when they are constantly high, so what happens is this can affect the stress response in turn. Okay, so this cytokines this constant stress followed by constant increase in cytokines can in turn affect the brain functioning as well as structure. So that is why reducing these cytokine levels through yoga has a significant impact in managing the neuropsychiatric disorders.
And inflammation is also a result of these cytokines only?
Sorry?
Inflammation is also a result of these cytokines only, I think?
Inflammation is a process. Okay, so cytokines are the mediators, one of the mediators of this inflammation.
Okay, sir. Thank you.
Thank you. We are receiving a lot of compliments regarding a wonderful session. We will take one more question.
Sir, excuse me.
Yes, please. Yeah.
Yeah, sir, you mentioned that in yoga group, the dorsolateral prefrontal cortex is there is lesser activation, and which were which gives like which in and then it produces increase in working memory, you said. I didn't understand about that.
No.
How
Actually, they were two different studies. Probably I mixed it up, I think. So the one study which looked at working memory, it compared yoga practitioners versus non-yoga practitioners, and it was shown that the yoga practitioners showed a significantly better working memory performance compared to that of non-yoga practitioners. And another study gave emotionally valent pictures. Okay, emotionally valent pictures. Say, for example, I'm not saying the exact same study. Say, for example, images. There will be emotion provoking images and neutral images. Okay, emotion provoking images, for example, disgust images are given. So how a person reacts to the disgust provoking images was examined in yoga group versus non-yoga group. Okay, so the yoga group showed very little activation. That means the reactivity to those emotionally valent images was much less compared to that of non-yoga practitioners. That means the importance or the salience attributed to such emotionally triggering images was much lesser compared to that of non-yoga. So that means they have an emotional control in their life, is what it means to say. You understood, ma'am?
Thank you, sir. Thank you.
Yes. Dr. Shiv, there is one question in the chat box. We'll take this one question
Yes.
last. Elaborate cortical silent period, how it is measured practically.
So cortical silent period, I'll give a disclaimer. I'm not an expert in TMS. So cortical silent period is something where it's a transcranial magnetic stimulation parameter. So wherein you give a stimulus and you see whether the motor response is to be seen within a particular threshold. Whether that motor response is what do you say, is seen within a particular period or not is something which is examined in cortical silent period. So if the GABA activity is less, then the cortical silent period is also less. If the GABA activity is more, then the cortical silent period activity is also. So if you ask me practically how do you demonstrate, I'm sorry, I am not a TMS expert. So somebody who knows TMS will know better.
Yes, actually, practically, it is very difficult. There is a device which has a magnet, 8-shaped magnet. You have to keep it on the motor cortex. Then you give a impulse, the thumb twitches, So the twitching, when you give the stimulus and then the twitching of the thumb, how much time did it take, and the threshold that you see there, that shows that there has been a time lag between the stimulus and the motor response, which is an indirect measure of the GABA function of the brain. So practically, you need that device to do that. Without that, it is very difficult to do it. Yes. So thank you so much, Dr. Shiv Kumar. Providing us wonderful insights, very comprehensively covering all the domains of mechanisms of actions of yoga, and sparing your valuable time. Thank you so much.
Thank you, Hemanji. Thank you for the opportunity.
Bye.